I always say the cornerstone of recovery for OCD is embodied in basically a single word, and that word is irrelevance. It's interesting because I often get a lot of pushback because anxiety is an incredibly relevant feeling emotion,
Right.
and it compels very relevant efforts to escape it. But what patients often don't take into consideration is their capacity to choose to relate to the signals, both the thought and the experience, with irrelevance. I approach irrelevance, I often talk about it in terms of talking to the barking dog.
Right.
Because, and that's why, once again, cognitive therapy is so ineffective, because
Right.
it's speaking to the broken system,
Right.
the malfunctioning brain.
Right.
But I also encourage patients to demonstrate
Yeah.
in a very behavioral way irrelevance through what I refer to as the unaltered life path.
Right.
Such a critical component and concept to be able to say, hey, I feel like I'm on the roof of a burning building, and yet I'm not going to engage in an escape effort. I'm not going to mentally plan the escape. I'm just going to put my lounge chair here, pour myself a Cosmo, and I'm just going to accept that the burning is building around me. And, at some level, we're somewhat aware, not experientially, that there is no fire, but there's a feeling of a crisis. And that's what anxiety is so capable of generating. And so the unaltered life path means to remain engaged in your life process, being at work, staying engaged in your endeavors.
Right.
Now, patients often complain that their anxiety is encumbering, that it can diminish their mental focus. And there's no doubt that if you're, on a burning building, you're going to be distracted about trying to escape.
Yeah.
And so, re-engaging in a task is going to be very, very difficult, and it's going to be encumbered by the distracting nature of anxiety. But the important thing is, and I use the phrase kind of living on the crumbs in that regard, that even if we are feeling distracted because of the anxiety, it's still so important that with whatever little parts of us that are available to achieve our professional goals or our life process, being at a party and not leaving, being on a date and not disengaging, playing with the kids and not going to your bedroom, that we remain engaged as a demonstration that this signal is not going to produce the altered life path that it compels.
Yeah. So with the unaltered life path, I describe that to my patients as what you would do if you did not have OCD. And that's just your life as you want to be living it. Easy squeezy. And I always do like this sort of hand gesture. I'm like, it's the unaltered life path, like this, what you would do. And they're like, okay, well, if I live my life, is that an exposure? Not exactly. We go a little bit further to one extreme if it's an exposure, but it's a good solid basis. Some things can be challenging and exposing without actually being an exposure. But that unaltered life path is a wonderful step in the process. If I'm not doing an exposure, I'm living my unaltered life path, even if it's difficult, even if it's challenging. And that helps to display the irrelevance that is the cornerstone. It is the brick and mortar of how you treat OCD.
Excellent.